In this video, I will explain you about some points about the stroke. A stroke, previously known medically as cerebrovascular accident (CVA), is the rapidly developing loss of brain functions due to the disturbance in the blood supply to the brain. You can see in the pictures. There are two types of stroke. One is ischemic stroke, another is hemorrhagic stroke. The ischemic stroke is 80% when the blood flow to the brain is blocked, while the hemorrhagic stroke is 20% when there is a bleeding into the or around the brain. You can see there is a blockage or clot in the vessels of the brain. There are so many risk factors and diagnoses for the stroke. Following are the risk factors: family history, older age, race, smoking, obesity, high blood pressure, diabetes, higher cholesterol, previous TIA infection, atherosclerosis, that is hardening in the arteries, and CVA diseases. The diagnosis of the stroke can be made by the CBC, coagulation profile, urinalysis, chest X-ray, ECG, glucose, finger stick if possible, CT brain scan, CT angiogram, MRI angiography, cerebral angiogram, LP spinal tape, ultrasound or Doppler scan, and cerebral blood flow exams. The sign of a stroke: you can see trouble in walking, trouble in seeing, weakness in one side of the body, and trouble in speaking. You can see in the diagram how these function affect by the stroke. There are so many treatments for the stroke, such as medical treatment, surgical treatment, rehabilitation, physiotherapy, occupational therapy, speech therapy, control of incontinence, provide a safe environment, in-home care, adult daycare or convalescent home, family counseling is also play a major role in terms of stroke treatment. Medical treatment. Intravenous administration of RTPA, that is zero point 0.9 milligram per kilogram, maximum 90 milligram, is strongly recommended for the treatment of carefully selected patients who can receive the medication within 3 hours of onset of the stroke. Aspirin can be administered within the first 48 hours because of reasonable safety and a small benefit. Corticosteroids and special type of intravenous fluid therapy to reduce or control brain swelling. Treatments such as ventilators, IV fluid, adequate nutrition, blood pressure control, and prevention of complications include in life support measures. No medication with putative neuroproductive effect has yet been shown to be useful for the treatment of patients with acute ischemic stroke. Other medications that may help to prevent a stroke from the recurring are called anticoagulants because they prevent the coagulation of the blood. Medication of this type include, for example, heparin and warfarin. Surgical treatment. Surgical treatment: internal catheter endarterectomy, intracranial bypass, clipping, a technique which clamps off aneurysm from blood vessels, which reduces the chances that it will be burst and bleed. Rehabilitation, physiotherapy, occupational therapy, special therapy. Patients are treated both medically and surgically, followed by the rehabilitation, as we explained earlier. Following the current clinical trials, you can find a stroke patient receiving TPA within 3 hours of the start of the stroke symptoms were at least 30% more likely to recover with little or no disability after 30 months. After receiving TPA, patients should not be given aspirin, heparin, warfarin, or any other antiplatelet or anticoagulant agent for the first 24 hours as they increase risk of intracranial hemorrhage. Newer treatment options such as intra-arterial thrombolysis, which deliver RTA directly to expand the therapeutic window up to 8 hours. Vitamin folic acid 2 mg, B6 225 mg, and B12 500 microgram is being studied to prevent stroke. Combined intravenous and intraarterial approach to recanalization is also being studied to be more effective and safe than standard IV RTPA alone when initiated within 3 hours. Cilostazol in acute ischemic stroke treatment 200 mg or cilostazol aspirin is given for 90 days and will be compared.